You are the head of the Parkinson unit in Cleveland Clinic, yes?
Yes, that's right.
Okay, can you tell us a little more? What kind of patient again?
So Parkinson's disease, as you know, Dr. Fatma, is a very common neurological condition. The numbers are growing worldwide. Now, when we look at Parkinson's disease, only 10% people, in the majority of Parkinson's patients, only 10% people need this advanced treatment options, which is the deep brain stimulation surgery. Now, majority of the patients are doing very well with a good medical approach, with a good team approach, having psychologist support, neuropsychologist, physical therapy, rehabilitation, speech therapy, and excellent nursing support. That is what we need for 90% of the patients. But some patients, it becomes very challenging, and they take the medications maybe every 2 hours or every 3 hours, and the quality of life is significantly affected. At that time, when it is really affecting their activities of daily living, we opt for advanced treatment options, which includes deep brain stimulation surgery or a pump therapy, which are the advanced options for Parkinson's and which we are routinely doing at Cleveland Clinic, Abu Dhabi.
That's amazing. What about other movement disorder? Is there any hope for them also with this technology?
Yes, so when we look at movement disorders, there's a subset of neurology where we are dealing with movements. The movements can be slow or they can be more hypo or hyperkinetic. Parkinson's disease is the most common hypokinetic movement disorder, where the movements are slow. The most common hyperkinetic, when the movements are more, is called essential tremor, ET, which is a very common neurological condition. Even in essential tremor, there's a huge role of deep brain stimulation surgery, where we can control the tremor symptoms quite well. Now, how the AI is helping in these patients is it can sense the brain signal. So when they come to me for the programming, I can see the tremor and I can see that there's a frequency in the brain which is being picked up by the small contact. And the contact is only in an area which is 5 millimeter in the brain. So from that area, it's picking up the local field potential, the signals, which is telling me that this is the contact within that 5 millimeter where the symptoms can be optimally controlled using AI. Once I have that, it saves me time and I can select that contact only and not touch the other ones, and it saves a significant amount of time and patient discomfort. In my fellowship years, when I was in US, we used to sit for 2 hours or 3 hours to do the programming. Now we can do the programming in half an hour. The only reason is we have a better technology. We have a better AI system which can detect these local field potentials, and if the precision is perfect, if the location is perfect, which is our goal in the surgery, and that's why during the surgery, the goal is to make sure that the chip, the lead goes directly inside that 5 millimeter target. Even if it's 1 millimeter side, lateral, posterior, we will not see optimal results. So it is very important the surgery has to be super precise, and that's why you can see in the video that the patient had a lot of tremor when he was holding the cup. And in the surgery, when the electrode goes in the area, we can hear the signals of the brain signals telling that now we are in the superficial part, we are going to the deep part, and that's the target area. And once we reach the target area based on neurophysiology, which is called microelectrode recording, MER, once we have that MER recording, then we do the stimulation and we ask the patient to hold the cup, and the patient is awake during the surgery. So patient holds a hand up and we see the tremor is under control, and we look for the side effects. So we know that the lead has been placed precisely in a good location, and then the patient goes back to the sleep. Dr. Tanmoy finishes the surgery, and then the patient comes for follow-up in the clinic when I do the fine-tuning and the programming, which takes up to 3 months' time. And that's where we are controlling the symptoms. We are not curing the Parkinson's disease. We do not have any cure for Parkinson's presently, but we have very good treatment where we can control the symptoms and we can reduce the medications by 50 to 80% reduction in the medications, and giving back the life to the patients so they can enjoy a good quality of life. That's what we're hoping for with the surgery.
This is amazing, really amazing.
Thank you so much, Dr. Fatima, for that illuminating panel discussion with your wonderful speakers. We were so pleased to hear from everybody there. Thank you so much.